The second part of the series of therapeutic problems. So the question is like acetaminophen paracetamol instead of salicylates is preferred in children. Okay, acetaminophen is nothing but the paracetamol, right? And is instead of salicylate, that is the aspirin, is preferred in children. Why? Okay, or use of salicylates with suppose any disease, chickenpox or influenza is contraindicated. So aspirin is contraindicated in children. Overall, you have to understand this. Why it is not so used? There is a risk of Rey syndrome. There is a risk of Rey syndrome. Salicylates has been linked to the increased risk of Rey syndrome. It is a rare but potentially life-threatening condition causing the brain damage and liver failure. Okay. Number 2 is gastrointestinal toxicity because it causes nausea, vomiting in children, leads to dehydration and electrolyte balance. Okay, the problem another of is the dosing complexities because it is a narrow therapeutic index agent, making it easier to overdose or underdose in children. Okay, so है ना, दो धारी तलवार. So this you have to understand. And another interaction with other medication, drug interaction with other medication. For example, suppose any anticoagulant is used. Anticoagulant and aspirin salicylate can lead to increased risk of bleeding. है ना. So these are the few important points. Again, I know that paracetamol still can cause liver damage if taken in excess, but overall, like American Academy of Pediatrics recover the acetaminophen as the first line of treatment for fever and pain management in children, while salicylates are for specific condition. For example, where aspirin is used, it is a pediatrics classical question in Kawasaki disease. In Kawasaki disease, aspirin is the drug of choice. Okay, you will learn a lot about this Kawasaki disease, and there are many disease which you have to be very specific, which occurs in children. Okay, I'm not going to talk in details about it. Okay, now thiopentone. Okay, thiopentone. Thiopentone is an ultra short acting anesthetic agent. Okay, thiopentone or thiopental. It is an ultra short acting anesthetic agent. So what are the characteristics? Number 1, rapid onset. Kitna onset rapid? 30 seconds. Short duration मतलब 5 to 10 minutes. High lipid solubility leading to increased chances of crossing the blood brain barrier. Okay, so causing the anesthesia. Right now, uses कहाँ पे होता है? Uses is the induction of anesthesia. It causes general anesthesia due to rapid action and short duration. Right. Number 2, procedure needing the brief anesthesia. Where are the procedures like needing the very brief anesthesia? Is the cardioversion, endoscopy and minor surgery. So this is how thiopentane is a very short acting, and it induces the anesthesia very rapidly as well as very short duration, so less side effect also, so it is used. In severe liver disease and malnutrition, the dose of thiopental is reduced. Okay, so why? Okay, so why explain? So number 1 is impaired liver function leads to decreased metabolism, leads to increased plasma level leading to toxicity. Number 2, altered protein binding, suppose due to malnutrition. What it does, malnutrition decrease in the albumin level, okay, increases the free fraction of thiopentin sodium, leads to increased effects leading to toxicity. The third is increased sensitivity, ठीक है, because of the altered pharmacokinetic and pharmacodynamic properties, ठीक है, there is an increased sensitivity of thiopental in liver disease or malnutrition cases. Now, how to minimize the risk, how to minimize in these patients? Number 1, monitor liver function. We have to adjust the dose, and overall we have to close monitoring of the patient. For example, in like respiratory depression, okay, hypotension or prolonged sedation. We have to see that if the patient is having these problems, right? Okay. Now, other important drug is ethanol. Ethanol is used in methanol poisoning, daru, right? How? Number 1, competitive inhibition. Ethanol competes with methanol for enzyme alcohol dehydrogenase, which is responsible for metabolizing the methanol into the toxic metabolites formaldehyde and formic acid. Okay. Number 2, reducing the toxic metabolite formation. By occupying the ADS enzyme, ethanol reduces the formation of all the toxic metabolites of methanol, thereby mitigating its toxic effect. Then, buying time for treatment. Ethanol administration is providing a window of time for medical professionals to administer other treatments like fomepizole, which is the drug choice, or hemodialysis to remove the methanol and its toxic metabolites for the body, है ना. How ethanol is given? पिलाते नहीं हैं, orally नहीं देते हैं. Number 1, it is given in IV setup. Ethanol is given IV for rapidly achieving the therapeutic levels. Just imagine, है ना, दारू को IV दे रहा है, right? In a control setting, ethanol should not be done in a hospital setting. में करते हैं, ये नहीं कि घर में दे दिए कि भाई 2 बोतल ले लो, जाके पी लेना, ठीक हो जाओगे. ऑब्वियसली नहीं, ये सब नहीं करना है. IV देना है in hospital settings, right? Now, fomepizole is the drug of choice. Why? Because it is a higher affinity for your enzyme, that is the alcohol dehydrogenase. It is a higher affinity for, and fewer side effects, very few side effects. Okay? So it is the fomepizole is the drug of choice for methanol poisoning. Okay. Next comes the dopamine. Now, dopamine is what? It is a catecholamine, and it is useful for shock. Which type of shock? 2 types of shock. Hemodynamic shock. What it does there? It increases the BP, the cardiac output, and perfusion to vital organs. Okay. Another shock, septic shock. In the septic shock, what happens? It again increases the BP and cardiac function. How it does? Dopamine causes, number 1, vasoconstriction. Dopamine causes vasoconstriction and increase in the blood pressure. Number 2, increase cardiac contractility. Increase cardiac contractility. Okay, so what is the dopamine? Increase the force of cardiac contraction, increases the cardiac output. And third is the increased renal perfusion. Renal perfusion, it increases the blood flow to kidney, causing the improved renal function. How it is given? It is given in IV and controlled manner. Controlled manner. What other things can be given? That is, fluid resuscitation can be done. Fluid resuscitation. Then another vasopressor agents. Vasopressor agents like norepinephrine or epinephrine to maintain the blood pressure, especially the norepinephrine. And inotropes. Inotropes like dobutamine can be given to support the cardiac support, है ना, as cardiac support can be alternative to dopamine, है ना. Now again another question is, vasodilators and not the vasoconstrictors are preferred in the treatment of shock. Okay, so vasodilators are given and not the vasoconstrictors are given for treatment of shock. Suppose this kind of question comes, है ना. See, now only we have discussed like how, like vasoconstrictors, where it is used, in which type of shock? Hypovolemic shock, volemic shock, anaphylactic shock, anaphylactic shock. In two places suppose vasoconstrictors are can be used, है ना. But in most cases, like the common cases, the vasodilators are used in case of septic shock and cardiogenic shock. Cardiogenic shock. This is what they are actually asking. You have to differentiate between the both. So where the vasodilators are given and vasoconstrictors are given, they have not specified. They may specify in the exam that which type of shock they want to hear. And the vasodilators, actually what it does in septic shock, vasodilators reduce the vascular resistance, increasing the cardiac output, increases the perfusion. In the cardiogenic shock, it reduces the afterload, improve the cardiac output, increase the perfusion. Okay, so vasodilators, what it does, it relaxes the vascular smooth muscle. Okay, vasodilators causes the blood vessel to dilate. Okay, reducing the vascular resistance and improving the blood flow. Okay, and also it increases the cardiac output by reducing the afterload. Vasodilators can help increase in the cardiac output and increase perfusion to the vital organs. Okay, what are the examples of vasodilators in shock? So vasodilators in shock, what are the example? Number 1, nitroglycerin. Nitroglycerin, it is a nitric oxide donor that help reduce the vascular resistance and increase cardiac output. The second is nitroprusside. It is a potent vasodilators, can reduce the vascular resistance and improve the cardiac output. The third is the milrinone. Milrinone is a specific phosphodiesterase inhibitor that can increase the cardiac output and decrease the vascular resistance. So this is how a vasodilator is used in shock. But again, if someone will ask about vasoconstrictors, it is used in hypovolemic shock and anaphylactic shock. Okay. Now, beta blockers used in hypertension. Yes, it may be used as a second line drug. And which are the drug used in hypertension? Basically the cardioselective blocker, cardioselective beta blocker. Cardioselective means metoprolol, suppose atenolol. Okay, in beforehand propranolol, non-selective one was also used but not used nowadays, but basically the metoprolol and atenolol. So what it does, it blocks the beta 1 receptor, in heart. है ना, decrease the beta block receptor. And beta blockers block the effects of epinephrine on beta 1 receptor in heart, reducing the heart rate and contractility. Reducing the heart rate and contractility. ठीक है. The second is first function. The second function is reduces the cardiac output. So decreases the heart rate and contractility. Beta blockers decreases the cardiac output, leading to decrease in the blood pressure. The third is decrease the renin release. Yes. So renin is also present because of the beta 1 activity in the kidney. So decrease the renin release. Beta blockers also decrease the renin of renin to control the blood pressure regulation. Blood pressure regulation. ठीक है. But as such, in hypertension, we don't give beta blocker alone. We give in the combination with the, suppose we give with the diuretics, or we combine with the ACE inhibitor, or with the calcium channel blocker. The diuretics, what it does, it helps remove the excess amount of fluid from the body. The ACE inhibitors blocks the conversion of angiotensin 1 to 2. This is a potent vasoconstrictor. And the calcium channel blocker, what it does, it relaxes the vascular smooth muscle, reducing the blood pressure. So it is not used alone, it is used with another agent. Okay, now now if we already used and beta blocker, and beta blocker, what it does, that it is not be withdrawn suddenly in case of hypertension. Why? Because it causes rebound hypertension. Stopping the beta blockers abruptly can lead to a sudden increase in the blood pressure, which can be severe and even life threatening. Okay, rebound hypertension, rebound tachycardia. Beta blockers actually causes bradycardia, right? What other drug causes bradycardia? Ivabradine, a funny sodium channel blocker, है ना. Ivabradine so causes the bradycardia. ठीक है. तो suddenly stopping the beta blockers can lead to rebound tachycardia. The beta blockers slow the heart rate. Stopping them suddenly cause a rapid increase in the heart rate, leads to palpitation, arrhythmia, and heart attack. Okay, all the kind of things. Third, there is increased risk of cardiac event, for example stroke or MI. ठीक है. So how to avoid this kind of risk? How to do it? Like we do the tapered gradually. When discontinuing beta blocker, the doses should be gradually tapered over a period of 1 to 2 weeks to allow the body to adjust. Okay, number 1. Number 2, monitored closely for rebound hypertension and tachycardia. Okay, so few more explain wise. First is the in pheochromocytoma, beta blocker are not used alone. Okay, and it may be asked in other way that both alpha and beta blocker are used in pheochromocytoma. Okay, number 1, why these things happen, right? Risk of unopposed alpha adrenergic stimulation. Okay, now what all things are happening? Pheochromocytoma. What is pheochromocytoma? It is a kind of a tumor, right? Pheochromocytoma produces excess catecholamine, epinephrine or norepinephrine, which stimulate both alpha and beta receptor. Okay, beta blockers, if there is beta blockers are suppose block alone, they can lead to excess of the alpha receptor action, leading to increased blood pressure, vasoconstriction, and potential hypertensive crisis. So this is what I am supposed to tell you. This is the how an adrenaline works. Adrenaline causing the alpha 1 and beta 2 response, right? Now alpha 1 causing increase in BP. So suppose only beta blocker is used, there is only, it causes beta is blocked only, and alpha action increase in the BP is there, leading to potential hypertensive crisis. To avoid what it does, we have to combine both alpha and beta blocker in cases of pheochromocytoma. So in alpha blockade, the the example of alpha blocker is phenoxybenzamine, and beta blocker propranolol, and they both are given together for the treatment of pheochromocytoma. Okay, now explain why a low dose but not high dose of aspirin is used as an antiplatelet agent. So you have to know that which dose of aspirin is used as an antiplatelet agent and why. So when you say low dose of aspirin, it is 80 to 100 milligram per day approx. So it is used as an antiplatelet. Okay, it prevents the blood clot. How? Aspirin inhibits the platelet aggregation, reducing the risk of blood clot that cause heart attack, stroke, and other cardiovascular event. Number 2, it reduces the cardiovascular risk. Low dose aspirin has been shown to reduce the cardiovascular risk like ischemic stroke and MI. Okay, now the high dose aspirin, what it does, increase risk of bleeding, and does not benefit the patient as such. Okay, because it causes increased risk of bleeding. It may cause GI bleeding, hemorrhagic stroke. Okay, so high dose of aspirin is not there. So low dose is very important. Why it is used as an antiplatelet agent, how it acts in the antiplatelet agents. Okay, so this is the part 2 of the video of therapeutic problems. I hope you are understanding and enjoying it. Sorry to be late, but I think I'll make 2 or 3 more videos for explain why. It may help in your theory exams.